Our vision at Intra Health is to create an environment where all people have basic access to healthcare services. We believe that health is the basic human need, and that is in fact the premise of all of our work.
That quality of service depends on quality of training is no myth. Those that take time to prepare students for a future full of opportunities attest that preparation is important. Although service is judged on individual merit, quality heavily reflects on the level of preparedness, detail, and precision with which training was offered.
The student, the health worker that he or she will become, will be able to interact with current content even at their workplace, and that way they're able to ensure that they're up to speed with the current guidelines and procedures that are required in their provision of services, and therefore will ensure that wananchi in Kenya get quality services.
Quality of services in the health sector, unlike many sectors, may mean life or death. For development to occur, governments must take keen interest in the health of their citizens. Kenya, like many African countries, continue to struggle with severe shortage of health workers because of either migration or unequal distribution. With high burden of ill health and HIV and AIDS, a majority of population scramble for the existing care providers, while many, especially in the rural areas, remain vulnerable. USAID-funded Capacity Kenya project to support systems that would strengthen human resources for health in public, faith-based and private health sector.
We do believe that the health workers in terms of numbers are not adequate, especially in rural areas where it is very difficult to keep health workers in adequate numbers with adequate skills.
Capacity Kenya established a Center of Excellence in Reproductive Health and Family Planning in collaboration with the Ministry of Health and the Kenya Medical Training College, KMTC, and African Medical Research Foundation, AMREF. The KMTC aims to coordinate national health training systems and programs for supporting development of pre-service and in-service education and continuing professional development for health workers while producing a health workforce with the required competencies to deliver the Kenya Essential Package for Health.
But when we were beginning and we were seeing and we were thinking about focusing on e-learning, developing an ICT infrastructure, there were things that we did not know that technology could have achieved within the 5 years. Like the ability now to do video conferencing and the ability of people to embrace ICT in teaching and learning, it was not embraced as much then.
Okay, to me it has done a lot of good because I find I'm accessing some information. At times I'm not late to do my assignment because the lecturer will come and give an assignment and say go to the computer lab and you research it. And because at least I get into the computer and I find several computers, unlike the ones that we had before, at least I access a computer and I can be able to do my assignment on that.
Officially launched in April 2011, the Kitui Center of Excellence supports faculty in identifying, developing, and applying innovative teaching methodologies focused on reproductive health and family planning service delivery. The center has established in Kitui to cascade e-learning in the East and Central African region and be modeled for replication.
We want to roll this out not to be Kitui only, but actually to all the other MTCs to achieve that excellence in reproductive health in our graduates, even in the other MTCs.
Establishing the Center of Excellence has involved installing a local area network, ICT equipment and furniture to strengthen the institution's resource center, upgrading skills lab with teaching tools and training aid, installing a power generator to mitigate power outages.
Something like headache, is it a side effect?
There are some drugs of anti-malaria. If you take, you have persistent malaria. So it can be a side effect of anti-malaria.
To prepare the center for the task at hand, Kitui KMTC staff received training on innovative teaching methodologies such as e-learning for reproductive health and modules, use of ICT in teaching, and content conversion and uploading.
This is one of the ways in which we as partners supporting training institutions in the public sector can encourage the use of ICT to reach the students so that they can interact with their materials on a daily basis, whether in their classrooms, whether within the training institution's campus, whether out there in the field, and also as beyond that as they continue with their service provision once in employment.
This is another area that KMTC, again, Kitui can scale up to other KMTC demo sites and to the other 33 campuses as a whole, to make sure that students are learning at their own pace and they are learning through their self-directed efforts.
What does it mean for a revamped skills lab? Between 2010 and 2013, a total of 278 students enrolled in the e-learning, family planning and reproductive health module and are utilizing the resource center and newly equipped skills lab.
Kitui is now at that stage where it can take the improvements that I've made into it to move beyond the boundaries of the college, the boundaries of KMTC as a mid-level training college, but also go beyond its borders to the East African mid-level training colleges.
I don't have to come to the lab to do what I want to do. I can do it through the phone.
The Kitui Center of Excellence will support identification, development and application of innovative teaching methodologies in the area of family planning and reproductive health service delivery. The Capacity Kenya project has partnered with the Ministry of Health Division of Reproductive Health to train KMTC Kitui faculty on how to mentor and coach health workers in the Kitui catchment area and train other KMTC faculty on family planning and reproductive health skills enhancement for placement and certification.
Using these mannequins, we are able to stimulate the baby to be asphyxiated, so the students might panic, but tell the student don't panic. It's not a real baby, and you're going to work. We want to see how you can attain those skills to be able for you to go and work in the practical area. So we assist the students, stop in between, explain to the students, show them how to resuscitate the baby until the baby can wake up and cry. Now they get excited.
So the time you're being sent outside for experience, you go there, being asked, maybe you can put on an ICD, an implant, if you can deliver, and that's it, you can.
So as we worked on the Center of Excellence, it was intended to work closely with the Kenya Medical Training College to ensure that the Kenya Medical Training College campus in Kitui becomes a center of excellence for the training of pre-service health workers through very highly sophisticated equipment in the skills lab and mannequins to enable these students come out with better skills and give them an opportunity to go and practice their training out in the field during their practicum.
We have different methods of...
KMTC has developed a proposal to roll out the Skills Lab model to 7 other health training institutions scheduled for June 2013 to February 2017.
What we plan to do is to use this center within the project
and to build on the work that has been done by the Capacity Kenya project through the Funzo project to make it a more vibrant center for health training. And this will be an example for what we can do for other institutions in the country.
With strengthened training, Kenya is making a bold step to reducing maternal mortality while ensuring that family planning choices are available and accessible to those that need it.
When those health workers are in place, then communities can thrive, and ultimately the world is a better place.